To our one more session of YouTube Live. So rains have started and we had done some symptoms or some remedies about elements from rain and all. So I think that is already done in my previous YouTube Lives. I'll just discuss a very interesting remedy and a very interesting case which I just treated with homeopathy. So this was a case, it was a very, appears to be a very simple case of tiredness, difficulty in walking, lethargy, no desire to live, weakness, prostration, mentally tired in life. And there were a lot of causes for that. The patient was elder in life. The patient had done all the responsibilities as an elder brother, as an elder son, as a husband, and as a father. And that has been for the process which was there for a long time, for years and years and years. Yeah, welcome Dr. Babla. And so this patient came to me for extreme weakness. I definitely prescribed some remedies, and he was not better as such, because he said, I am not getting that feel of that feeling better. And now he says, now carrying the burden of my family and all, it normally does, I don't like it, because whenever now I see that, or somebody telling me that you have to do this, you have to do this, it feels a burden to me, and my weakness, my letharginess, my anxiety, my stress increases. Previously it was not like that, but now it aggravates. I just took one simple rubric. There's a rubric, I got that rubric. I took that rubric. Anybody, if you can guess that rubric. I opened Fatak's repertory, and there's a rubric called as carrying burdens aggravate. It is not carrying burden, carrying load, carrying a sack of rice, or carrying a sack of lentils or peanuts or sand. It was that burden of mind. Carrying the burden of mind. There was so much burden, and because of that, he was tired and did not want to carry that burden. And whenever that burden, that responsibility of the family, of the mother, of the father, of the brother, wife came, he got all the symptoms of letharginess, weakness, and XYZ. Adding few symptoms, I just prescribed the patient cadmium brome. It was a very rare prescription from my side only, but I took only one rubric for that prescription, that was cadmium brome. And with cadmium brome, this patient recovered beautifully, and now he's back to his carrying of burdens, carrying the responsibilities. He feels absolutely fresh. And he told me one thing, sir, in spite you not giving me any tonics, you did not give me any tonics, you did not give me anything in diet, but still homeopathy worked. I had taken lot of tonics, lot of vitamins, lot of counseling, nothing worked. But in your remedy, I am feeling so fresh, happy, and I was what I was before, carrying the responsibility of the family. So this is Sora. This is Sora. The patient is back to Sora. What he was, he is now happy, carrying the burden of the family, carrying the responsibility of the family, with a single dose of cadmium brome. So welcome Dr. Alexandra, Dr. Feroz, Rasik, Dr. Bharat, Dr. Bilwalkar. So this is the beauty of understanding and interpreting the patient's language into the rubric form. So I'm very happy that my assistant doctors are on YouTube, so that they can give you the rubrics and the remedies which because I'm very fast. So other symptoms of cadmium brome, whichever I got from that patient, I'll just tell you. That is first symptom, the second symptom which basically is important in cadmium brome, is fear of solitude. Fear of solitude, or you can take that fear if others are approaching him. So this was also there in the patient, and I took that rubric, burden aggravates, and this symptom, and I prescribed the patient cadmium brome. So I hope everybody understand that. I hope can we go forward? Yes, cadmium brome. So yes, so this is the beauty of Mater Medica. This is the beauty of repertory. I would only say this is the beauty of art of interpretation and prescribing. This is how you must interpret. Of course, I am not the authority and I also make a lot of mistakes, but still, if you are in the path, you will definitely enjoy your practice and enjoy the moments of cure which are there. Second case, if I don't have any questions, I'll just go forward. This was a case of Gilbert's syndrome, problem of liver problem, and this a very learned patient. He was a lawyer by nature. I hope there is no question so that I can, otherwise, some of the people in WhatsApp tell me, sir, you describe your case and then we can't ask anything to you. So if you have any questions, you can always keep a question so that I can come immediately after I finish my case. So this was the second case. I'll just discuss that. So he was suffering from liver problem, Gilbert since long, and this patient came to me just for bloating of the abdomen and gases problem XYZ. And every time he used to come, he used to tell me, sir, just did my blood report. You did not tell me, but just I was going for my father's blood test, so I thought I also take the blood test. I said okay, and he used to show me the report. I said everything is normal. I said, sir, that bilirubin, it should be 1.2, but it is now 1.1. Is there any problem? I said no, there's no problem. It's okay. Okay. I did a sonography also to check my liver. See, the liver is okay, but give something that it should be more okay. Okay, so I'll just halt and take a question first. If we take solid food, urination stops for some time, sir, and urination starts after midnight to early morning. He has no diabetes but has BP and heart problem, taking allopathy medicines. If he takes solid food, urination stops for some time and urination starts after midnight to early morning. Okay, see, Dr. Padde, see this case, if the patient takes solid food and the urination stops, I have never had the symptoms in my case. In your case, if the patient is not suffering from diabetes but has BP problem and heart problem also, this case would have these type of problems. In our repertory, there is a very beautiful symptoms, or you can say, beautiful rubric. I think last time somebody had asked me this question. I have already answered this question, but still I'll tell you. If this is the case, there are 4 remedies which are very, very important in your case. The first is gelsemium, second is muriatic acid, third is sepia, and the fourth is ignition. Of course, there may be a lot of remedies, but urine clear, fine, no diabetes, no problem except heart problem. You can add 2 remedies more. One is phosphorus and second is phosphoric acid. Patient becomes angry when his son or wife or anyone in the family becomes sick. See, whenever our close to heart persons, whenever our family members become sick, we become anxious. But this guy who is becoming very angry, very, there's a beautiful rubric in our repertory, means this patient cannot bear, who is sick, and if the patient is sick, his reaction is very hyper. He becomes very hyper if the patient becomes sick. A simple rubric, anxiety because the patient, the relatives are sick, and the reaction is hyper. So the reaction is hyper. Anxiety exaggerated. Just now, I just taught this rubric to my, doctors who are with me. Anxiety exaggerated. If they are online, I think they can answer this question very well. So anxiety exaggerated, and there are so many remedies, for that. So if you can give me 1 or 2 other remedies, other symptoms, we can definitely have a good remedy for your case. So this is anxiety exaggerated. Okay, let us go forward. So I was talking about that case of Gilbert's. So next time he came with his wife, his wife had a problem of cough, cold, coryza, and he said, my wife is there. I just went again to the doctor and just checked my report just to see whether the bilirubin has come to below 1.1. I said, why did you check? It was normal. No, I just checked it and I just did a CT scan again of the abdomen just to check. Sometimes, Doctor Sahab, The sonography does not show everything. So I did a CT scan. That is normal. Again, I prescribed the remedy and everything was fine. I'll just take one question more. My daughter is 9 years old. Can I give Blata Q for uncontrollable cough? Please help. Yeah, you can give. Salam, Muhammad Salam, you can give the patient Blata Q, but Blata Q can only palliate. But a prescribed homeopathy potency according to the case taking will cure the case. Okay. Sir, my father, aged 80, suffering from nearly 30 times a day with extreme weakness, urination being his evening 5 to 7 and after midnight. See, in your case, if you open the chapter, urination profuse, that is urination profuse. In your case, it is classically in the evening. Okay, so we have two symptoms in your case: urination profuse and urination especially in the evening. One more symptom you can add: urination profuse in old age. So if you try to repetize these type of symptoms, you will get few remedies which are very, very common, whichever I can get. Whatever I can repetize now is, first would be lycopodium, second would be sulfur, third would be oxalic acid, fourth would be fluoric acid, and fifth should be, I think, thuja, if I'm not wrong. Okay. Sir, is there any effective medicines for prostatomegaly 28 cc urinary? Yeah, definitely it's there. And I have a case which I have a lot of cases where I have treated and cured this type of complaints. Again, coming to that case of liver disorder. Now, again, the patient in 2 months, I think he was falling for 4 months. He had done 3 times blood tests, 2 times scan, and 1 time sonography. And he used to always have one reason: I have got this patient. So he was going, so I also went. He was doing, I also did. My wife was doing, so I also did the test. My father was doing, so I did the test. I was prescribing him the medicine. He was okay, but not cured. And then I prescribed the medicine. So tell me, okay, so for the help with the patient with bladder, okay. Okay, when he comes back, I think we should again prescribe the remedy. Or I think we should see which symptom is left after the operation, and then we can. Did you prescribe the patient arsenic? Okay. So I think when he comes back, I think we'll again review the case again. Okay. So again, that case, which remedy comes to your mind? That case of liver problem, Gilbert syndrome, doing continuously checking the reports. He came to us. He was okay, but not totally cured with the medicine. Which symptoms come to your mind? Anybody? Which symptoms come to your mind? Anxiety trifles, hypochondria. Yes, definitely. But anxiety trifles has lot of remedies. Hypochondriac has lot of remedies. So how will we prescribe? Remedy for, just a minute, a remedy for anger. Okay, on slightest provocation. Now this is again a very interesting question. Now if you have a repertory, or if you have Matra Medica, I'll just give you one symptom that's an implied symptom. You can take the rubric anger touched when, means you slightly touch the patient mentally or physically, start shouting. Anger touched when: tarantula, antium crude, chamomilla, sanecula, lachesis. Anger touched when. Okay, I hope it answers your question. Urine profuse at night, aggravation, woman at left side paralysis. Whatever I told you, the evening part, and you can of course take the night part also, urination. That also could help you in your prescription. So if you want to say urine evening and night especially, then there is a remedy for that also. You can have the remedies: urine watery especially at night, Merxol, gelsemium, phosphoric acid, ट्यूक्रियम मारम है. सर मुझे एडेनोमाइसिस है, क्या आप ट्रीटमेंट करेंगे? I would suggest that if you do case taking in front of the doctor, case taking in on telephone is okay, we can do that. But if you do case taking where you're living in front of your physician, it will be much better. Okay. Sir, daughter having nasal polyp, can I? My daughter having nasal polyp, can I have drop? Can I give drop of SBL name sinusitis? Sorry, Salam, I have never used that, so I cannot comment on that. Same remedy applies? No, no. When the patient has gone to the operation theatre and come back, so you have to again ask the existing pathology, what is there, the existing symptom, and what has changed mentally in the patient, and then we can again prescribe the remedy. Okay. Patient talks all medicine suggested by different people or doctor at the same time. Yeah. So this is a very interesting thing, you know. You can say the patient by different doctors. So the patient actually is, you know, Dr. Feroz, groping in the dark. Groping in the dark. Just arrive with letter carrier. Very nice. So I hope you got the remedy, and then we can should I look for nux or stephysagria? If the just WhatsApp me the symptoms after the operation, and then we'll see. How much doses of arsenic you had given, Dr. Alex? सर मुझे एडेनोमाइसिस है, ट्रीटमेंट क्या है? ट्रीटमेंट बहुत सिंपल है. ट्रीटमेंट इज होम्योपैथी. ओके, यू कैन डेफिनेटली ट्राई. Explain in terms of Dalkamara. See, now what happens, Dr. Amit? For example, I don't know where what symptoms you are versed with Dalkamara, or which theory you are following for Dalkamara. Different doctors have different theory about the same remedy. Okay, for me, if you ask me Dalkamara, a Dalkamara patient, what I have seen is a patient is very abusive, a patient is very insulting, a patient is very angry without being angry, without being insulted. That is the entry point of Dalkamara, for no reason. The first thing, if I enter the case, I would suggest that. Are you with me? Second, a Dalkamara patient, if he comes in your OPD, these are the gestures the patient makes. Gestures makes grasping at mouth. Grasping at mouth. Second symptom. Okay. A Dalkamara patient, if he's sitting out in your OPD and you can hear this noise, that is Dalkamara. That means the patient has restlessness with stamping of feet. That is Dalkamara. Okay. A Dalkamara has weeping from impatience. A Dalkamara has weeping from impatience. Tarantula, lachesis, antimcrude are different breeds of drug. So if your Matramedica understanding of Dalkamara matches with me, then automatically we can go forward. Yes, so Dr. Alex, just take the, if arsenic is not given, then again we can redo the case. Okay. Okay, he went to the hospital. Let him come from the hospital. Then we'll see how does the patient behave, now what are the symptoms left, and what is it. Aphorism number 3. What is there to be treated in the patient and in the disease? That is very important. Okay. So I hope, Dr. Amit, you understood Dalkamara. Okay. So this is Dalkamara for me. Now, if you open your Matramedica and Dalkamara, different doctors might have different thought of Dalkamara, different concepts of Dalkamara. So I cannot tell you which to follow and what not to follow. For example, if you tell me antimcrude, in same relation to the anger of Dalkamara, a antimcrude patient becomes very angry on every little attention. You give attention to antimcrude, he becomes very angry. He becomes very, very angry. That is Dalkamara. Second, a Dalkamara patient has lot of irritability. When you touch, the child starts crying. Very close to Sina and Chamomilla. Sometimes when Sina Chamomilla fails, give antimcrude. Sorry. A Dalkamara patient, of course, it is very sentimental remedy. I will not tell you that. A Dalkamara patient has lot of perspiration with violent headache. You can see that and the patient will tell, antim crude. An antim crude patient will tell you, doctor, whenever I have headache, I start perspiring. There is so much pain and the patient starts perspiring. That is antim crude. Okay. A Dalkamara patient, a Dalkamara person always desires ideal woman. A woman should be like this, like this, like this, like this, then I will marry. That is antim crude. So these are the difference which I have seen in my practice. That's why I'm telling you. That's why I always tell you that if you're asking me mathematics, I don't know what thoughts you have in your OPD and what thoughts has been put in your soric mind when you are studying, and that is very difficult to erase. But whatever I am telling you is what I have seen in my practice. That is antim crude Dalkamara. Okay, let us go forward. Bad smell from mouth and sensation, something mucus stuck in throat. Slide better by warm water intake, later again mucus in the throat. Yeah, this is simple. Maxol 30, I don't know why did not it work, but mucus in the throat, better by heat. There are 3 remedies which should come directly in your mind. The first is you have to think about Kali bichrome. And second, you must think about Naxomika. Okay, mucus. And then there are other remedies also, but try these 2 remedies first. Okay, so please make video on how you take case like infertility, cirrhosis, prescribe medicine, so you can get idea how to prescribe medicine pathology. Okay, Dr. May, I'll try my best. Live Mathemedica, yes. Whatever Mathemedica I am telling you or discussing with you is what I have seen in my practice. Whatever assistants are with me, they are with me. Always tell them that my Mathemedica, what is written in books, might not be so good because I have left studying in after college days. Whatever I am studying is through my patients, what they tell me, and what I convert their language into the rubric form or the Mathemedica form. So I would be basically treating those type of cases where I have my experience treating with it. Okay, that is mucus in throat. There may be so many remedies, my dear friend. There may be so many remedies, but Kali bichrome, Nux somica, in fact Argentum nitricum, in fact Lycopodium. These are the remedies which I have used lots in my practice with very good results. So don't forget Kali, especially the patient comes says in the morning the mucus is so thick, I have to do and then I have to spit it out. It does not come out. So Kali bichrome and Argentum, pulsatilla also are fantastic remedies. Any ringworm ka medicine, Dr. Kumar, very difficult for me also to treat, but ringworm you can get results with bacillinum, teucrium, sulfur, graphitis, natramure. Good remedies. Good means all remedies are good, but these are the frequently used remedies. Any specific urinary inconsistency, sorry, Dr. Sheikh, I would not be able to help you because I don't know the specific of that. How to sure about medicine before giving it to patient? Very, very interesting question, Dr. Saab. I would say if your syphilitic symptom depends on the case which miasm the patient has come to you. If your miasmatic symptom which you have taken for repetization matches with the patient, then you can be sure that the remedy would work. Sir, what is the importance of Bird's physiological Mathemedica? If you open, every Mathemedica written by doctors has its own importance. For example, people tell me that Allen's Keynote is such a small book, and you keep telling read Allen's Keynote, but these are the basic books, If you read the basic books, ultimately then you can build upon that. I'll just give an example. Bird's physiological Mathemedica. Now, Bird has written 2 Mathematicas. One is physiological and one is characteristics. Simple drug aconite. You open aconite and it is written, it acts through cerebrospinal nervous system. Aconite has 9 special centers of working. Now, your pathology, your books of medicine should be very sure that what happens if the remedy works on the cerebrospinal nervous system. If the remedy works on the cerebrospinal nervous system, the first expression would be paralysis. If in aconite, if the remedy is working on lungs in aconite, it will cause congestion and inflammation. So it depends on your inclination, how you know the pathology, the physiology, and the mathematica. When I studied pathology, anatomy, I had we had not such good knowledge about this, so I have used very sparingly Burt's physiological mathematica. Okay. Sir, how some remedies for groping in? My dear friend, groping in the dark, I think everybody would answer that question. Groping in the dark. I had cured a case of wrist drop, cured the case of wrist drop with plumbum metallicum. The remedies for groping in the dark, there are only 4-5 remedies. One is plumbum, second is opium, third, fourth, fifth I cannot remember. 2 I can remember, opium and plumbum. Okay. Ear hurts only when pressing with finger, pain in the throat only when swallowing on empty, emulsion from solid. All left side pain in throat like rawness, but emulsion from warm discs, feeling weak like flu. Sometimes, if there are 3 or 4 characteristic symptoms, then you feel now what to prescribe. If you prescribe on one rubric, that does not cover the other rubrics. But let's solve this case. Now, in this case, what Dr. Alex wants to know that first of all, better by warm. I would say there are most of the remedies who are better by warm. So if you want to do rubric selection, if you understand books of medicine, there are a lot of medicines, but few medicines better by cold. So I would first eliminate that. Second, ear pressing and all. So in this case, very symptoms which you can laugh off. There are very contradictory symptoms, but this also would make a beautiful case. There are 3 remedies that comes to my mind now, and I think from one of the 3, one has to work. First is ignitia. Second is lachesis. Third could be Kali bitch, and fourth would be hyoscyamus. One of the 4. Sir, offensive odor in cancer of maybe you can try. No, I had a case where I had good results with ichnisia, angustifolia, 1. Second, cinnamonium, which you have given. Third, curcumin, you must think about that. Fourth, bacteria. Yes, so I think I was asking everybody what was the remedy. Dr. Vishaka said, what was the remedy for Gilbert syndrome? What you will prescribe? The answer in such questions, the answer in such questions lies in what the symptom the patient is telling you. Okay? A liver patient, very hypochondriac. Just put that word in mathematica. Hypochondriosis in liver trouble. Only one remedy. I prescribe the patient podophyllum. And podophyllum cured the case. That's the beauty of understanding the symptoms and the repertory language. I think that case I have put in my Grey Ceiling Academy group where I keep posting some cases. So I think I must have posted there. That's why I did not know it. Sir, why we are not giving importance to research and development of homeopathy? We are only focusing on new methods and also forget what old master taught. Please give guidance to youngsters. I always tell to my assistant doctors who are with me, they are doctors only. Whenever you have a problem, whenever you are confused what to give, how to give, what to apply, which theory to apply, go to Sora. Our Sora is Hahnemann. What Hahnemann has written, if you open the books, calm your mind, read what Hahnemann has given, you will start getting results. That is what I basically practice, and I tell my students to practice also. Sir, I don't use any app for repertory. I just use different repertories to find the remedy. Can we get exact remedy using books only? Yes, why not? You can get exact remedies by using books also, no problem. No, Dr. Vishaka, they are doctors basically who are working with me, who have left, but they still want to be in touch with me. So that is, maybe a doctor has taken the case, then she has left, and that case has been cured. So I put on the WhatsApp so that she knows that whatever she had taken the case and we had given the remedy has worked. That's why. Any remedy for, because if the group swells up, then everybody starts posting there. I had mathematical group. I had made the group for that only, but then people keep posting and asking questions and posting other things, so that the whole idea of understanding and learning is lost. That's why I have the group doctors who have joined me. Okay, thank you so much. I think it's already half an hour up, and thank you for joining me. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Bye.